Hello, good afternoon. Today we're going to be answering your questions about COVID-19 vaccinations in Brevard County. I am Isadora Rangel. I am the engagement editor at Florida Today. And last week we did something similar. However, just a day after we did a Q&A, a new system for appointments was launched by the state of Florida. So now we want to make sure that we are updating you on that new system, how it works, where you have to go, and how our vaccinations going here in Brevard County. And with me are Dave Berman, Growth and Business Editor at Florida Today, and Don Walker, the spokesman for Brevard County. Welcome, gentlemen.
Thank you.
Thank you.
So just so we all understand how the sign up is happening now, it used to be, at least if you're signing up through the Department of Health here in Brevard County, you were required to use Eventbrite. Now that has changed as of Friday, I believe. Don?
Yeah, about noon on Friday.
Yes, that old system obviously made a lot of people very confused and upset. So how does the new system work?
So it's really kind of the best of both worlds. So we initially, when we kicked off the vaccination program in Brevard County through the Florida Department of Health, they used a phone system for people to call and make appointments. Well, the phone system there was so inundated with calls, it crashed the system. So the county implemented use of the internet program Eventbrite, and that also worked, very well in my opinion. Although there were some kinks to the system, I agree with that, but it did work the job that we needed it to do. We were told about a week or two ago that Brevard County would be probably one of 8 counties that would help soft implement this statewide registry. We just didn't know when. And suddenly about noon on Friday, we were notified by the state that the system was up and running. And not only were we on it, but every county was on it. Now, all counties have not chosen to take part in it, but Brevard County has decided to move all of our appointment registrations over to that state registry. And all people need to do to register for a COVID appointment is to go to myvaccine.fl.gov or call 866-201-5420. And what they can do is they can register their name. And then as vaccines come in, the state will contact them, set up an appointment, let them know when they need to show up for their vaccination, and they can come and get it. And of course, as good as that sounds, it's all depending on how many vaccines are available. So we found out today, just this afternoon, that we currently have 10,000 people registered. And this week's allocation of vaccines was 1,500 doses, 1,300 of which are going toward appointments for vaccinations at FDOH here in Viera.
And just to clarify for people who are just joining us, you still have to be at least 65 years of age or a healthcare worker to get the vaccine through the Department of Health. I'm speaking with Don, who works for the county. You can also get a vaccine through Publix, but now we're going to be talking strictly about the Department of Health because Publix has its own appointment system, not to get those two confused.
That's correct.
And Dave, please jump in whenever you want. But I have a question, again, just to clarify this, and there's a story at floridatoday.com if you want to read it. But also now people under the age of 65 with comorbidities can get a vaccine, but there is a caveat to that. And I want you to explain, how they can get that vaccine, because I don't want people to think that it is open to anybody under the age of 65 with comorbidities, because that is clearly not the case. So can you please explain that, Don?
Right. So that is causing some confusion. So the CDC guidelines are if you're 65 or under and you're at high risk or vulnerable to COVID-19, you've got a health condition, whether it's heart disease or something like that, that if you're under 65, you would be eligible for a COVID vaccine. That's not being done through FDOH, but what they are doing is the hospitals systems, Health First and Palm Bay Hospital, that, for example, received 1,000 doses this week from the federal government through the state. If they have patients that they determine are at high risk or vulnerable, they can do a vaccine for that patient, even if they're not 65. But as far as the county goes, and as far as Publix goes, you still have to be 65 and older, a healthcare worker with direct patient contact who's not affiliated with the hospital system. Those are the requirements, along with being a Florida resident.
So even if you're not 65 years of age and you have a comorbidity, we're not telling people like to show up at Health First or Palm Bay Hospital, right? They will choose who those people are based on whatever comorbidities they have. So people should not be showing up at these hospitals saying, I want a vaccine, right?
Right. So it's really the hospitals that have patients already at their facilities that they determine need that shot, even though they don't meet the current requirements from the state.
Okay.
And the two hospitals that have gotten those vaccines ready are Holmes Regional in Melbourne and Palm Bay Hospital are the only two hospitals in Brevard County that were given allocations in the current.
Right. So the good news with all of this is now we're seeing this week, the county got vaccinations. So we got 1,500 doses, 1,300 will go toward the community. 100 are going toward municipal firefighters and paramedics, and another 100 doses we're holding on to for the moment because we're trying to develop a kind of a pilot program where we can get shots to folks who are homebound. So those details are being worked out right now, but we're going to try to do more outreach. And so while the county got 1,500 doses, now you've got Publix with its doses, and then you have the hospitals with some extra doses. So, there's more vaccines in Brevard County this week than we've seen, but it's still an extremely small number compared to the demand out there of people who want those vaccinations. But hopefully those things will ramp up, especially with the Biden administration saying today that they're going to start getting vaccines out to retail pharmacies. So hopefully sooner than later, we'll start even seeing vaccinations available at CVS and Walgreens. But right now, we're doing the best we can with the doses that were allocated to get shots in arms to as many people as possible.
And the governor just announced yesterday that he's also looking at possibly getting vaccines at some point for Walmart stores and for Winn-Dixie stores if there's enough supplies, because he's in discussions with both those companies. And in addition, he announced that the supply for this past week went up from it was 266,000 the previous week to 107,000 doses in the current week. So about a 40,000 increase this week. So he's hoping that we'll see more vaccines going to individual counties because the state of Florida is getting more from the federal government now.
Yeah, and just to clarify, even with what Dave's saying, though, you have to remember that while the state is getting 300,000 plus doses, they have to allocate those out among 67 counties. So, so when Brevard County gets its 1,500 doses, that's our small portion of what the governor's distributing out there. But hopefully, again, those numbers will continue to increase over the weeks and months ahead. Hopefully, weeks and days. But well, we know what the mission is. We just need the supplies to complete it.
And Don, I believe you sort of answered Janie's question about homebound patients who are over 65 years of age. If you could speak more about that for folks who are not able to leave their homes.
Well, because we're getting such low numbers of vaccines, we're doing our distribution or our vaccinations program here in Viera, which is at the Florida Department of Health, which is centrally located. We want to get the vaccines out in the community. We've made plans. We've done expansion plans. We've got hospitals on board. We've got a private contractor on board. And as we get more vaccines available, we're going to try to spread this out farther and wider in the community. It may be that if they can get enough vaccinations out to the retail pharmacies, to the Walmarts, to the more vaccines to Publixes, we may never even need to implement our expansion plans because there's a CVS and a Walgreens just about on every other street corner. Everybody seems to be able to make it to Walmart. So I mean, hopefully, by utilizing those types of commonly used locations, retailers, we can get more shots in arms and we get a broader outreach in the community. But we do realize that there are people that don't have transportation. There are people who are homebound, and we are looking at ways to reach out to those folks and get them those vaccinations. But again, all of it contingent on the amount of vaccines that we receive. But they haven't been forgotten. We're trying to do our due diligence because we know there's that need. So if there's nothing else, I hope I leave here today and let people know we're thinking about you. We're working to get to you. And as we continue to get more vaccines, we're going to see if we can make that happen sooner than later.
Yeah. And we have a good question from Pat Diaz here on Facebook. Thanks for your question, Pat. And this is great, and I think it allows you to talk about commonly asked questions. And I know we've heard this one before. Is if you register your first shot at the DOH and were given your second appointment, do you need to re-register on the new system, or is the appointment given still good? Good
Yeah.
time for that question.
So I shook my head like this only because I was glad to hear that question, because that's one we want to address. If you got your first vaccination at Florida Department of Health in Viera, everyone who got their first vaccinations were given a card with an appointment for their second dose. If you've got that, that's all you need. You don't need to call the registry. But when you show up for that shot, be sure that you have your appointment card, that you have a consent form, and you have an ID, not only to identify who you are, but to also prove your residency, because you got to be a Florida resident. You don't have to be a Brevard County resident, but you have to be a Florida resident. And if you are an out-of-state resident, you had your first vaccine here before the governor said you had to have Florida residency. So let's say you're from New York and you had your first shot here and you got an appointment for a second shot, you are still eligible to get that second shot. But if you're an out-of-towner and you're hoping to get your first shot here, you're not going to be able to do it because you now have to be a Florida resident.
Yes, and just to make sure, I believe you said this last week, but Brevard is holding on to those second doses, right? So is the state of Florida?
Well, no, the state has provided us the second doses because the
Okay.
state's working on the second doses, but we have them and we are distributing. We've been doing second doses all week. So there are people now that are getting their second doses. We've got the supplies in hand to do that, and we will continue using second doses until the governor says otherwise. I know there's been talk about using those second doses, which are exactly the same as the first dose, to do more first doses. But until it's dictated that we do something differently, we are using those for second doses. So if you have an appointment for a second dose, we have the doses there. You need to show up for your appointment.
Question a lot of people are asking is whether you have to keep signing up to the site every week, or is it just one time you sign up and then you're on the list and you'll be moved up the list and it's your turn?
Sure. So it's a one-time registry. You only need to register once. What we don't know is this. Let's say Isadora registered, and I registered, and Dave registered. And they call Isadora to tell Isadora, we have your appointment. And they can't reach Isadora. She's not answering her phone. She's not getting the message. The question is, and we don't know the answer yet, does that mean that I move up in the registry and she moves to the end of it? Or do they keep trying? Or what happens? We don't know what happens if they try to reach Isadora to make her appointment and she doesn't answer. We are working to get those answers, though, because we know people are wondering about that. As much as we're all connected to our phones, we're not always connected to our phones. So we will get answers to that. And, those are questions that we're asking. And unfortunately, I can't answer that question now. But let's just hope that, that you are there when the phone rings. But also, if you've registered, you are registered. You don't need to keep going in there week after week. You are on the list, and they will be reaching out to you once vaccinations reach the level where your name comes up.
And how will they reach out to you? Is it a phone call? Is it a text message? Is it an email? Or does it depend on how you signed up for it?
I think it depends how you sign. I think. Yeah, if you signed up online, they'll probably reach out to you online. And if you called to make an appointment, they will call you back. So.
Okay. And Donna, I have a question. This was actually brought up by one of our reporters. She's gotten a lot of calls about this, so I'm sure you've probably gotten them too. There's an Orlando TV station has reported more than once, by the way, that Brevard is not participating in the statewide pre-registration system. Speak about that. I mean, is that just a rumor? Because we are part of the registry, and you still go to myvaccine.fl.gov, right?
Yeah, no, I mean, I'm very, very happy that you asked that question because I've been dealing with that as well. One of the Orlando TV stations, unfortunately, reported last Friday that Brevard County was one of the counties that was not taking part in the registry. However, that was completely inaccurate, and I had to reach out to that station and ask them to do a correction, and they did. But unfortunately, you know how the TV networks, their news comes on at 4:30 and is on till 6:30, and then they don't come on again until 11 o'clock at night. So people that heard that Friday afternoon or at Friday evening were probably not around for the correction that came out later that evening on their nightly news. So Volusia County is not taking part in the registry. They're one of a few counties that have chosen to not be part of it. However, Brevard County, if you want to register for an appointment through FDOH, you have to do it through the registry, myvaccine.fl.gov. If you want to get a vaccination at Publix, you need to reach out to Publix. They have appointments they post every week.
Okay. Again, two separate systems, one through the FDOH, which is the one that Dawn has been talking about, and there's one through Publix. You have to sign up on those two different systems separately just to make sure. I know it's a lot of information and it can be confusing, and that's why we're here. And right now, only people ages 65 and up and healthcare workers are eligible for the vaccine. We talked about hospitals getting vaccines for people below that age with conditions, but those people need to be patients at the hospital. So it's up to the hospital's discretion. But Connie has a good question, and I know we're not going to be able to answer this, Dawn, but I think it'll still give us good things to talk about. Is any talk on when the age will be lowered to those who are not 65 but are at high risk? And just as a reminder, in Brevard County, there are roughly 145,000 people over just 65, almost 5 million in the state of Florida. It seems like is there talk about that? Are people even contemplating that at this point?
Well, we get that question a lot, and I know it's frustrating because, again, it's really based on the allocation of doses to the county. But yeah, you're right. We have, more than 150,000 seniors in Brevard County, 65 and older. And, basically to this point, we've given out almost 46,000 doses of the vaccine. So that's a small fraction of the number of seniors. And you don't move to the next level until you get a good, handle on that population. If you don't, or you do them all. I'm not sure what the governor's plan is for when he'll, go to the next phase. But yeah, we still got a long way to go, unfortunately, in Brevard County to reach, I think one promising thing is this: even though we're only a fraction of the 50,000 that we have that are 65 and older, if you think about the numbers that I told you about who's gone on the registry so far and asked for an appointment, there's 10,000 people. Well, the registry opened Friday. The news about the registry has been around now for, 3 and 4 days. So the fact that there's only 10,000 on the registry is a surprise to me. So, the good news with that is wherever your name is on the registry, it's a lot closer than it might have been had there been 80,000 people whose names were on that registry today. So, I'm hoping that they can move to the next phase, hopefully in the spring. But if it continues the way it is right now, where the doses are basically trickling through the state, you could be talking late summer, early fall at the earliest. So, the way it's going right now, I would, let's hope it's this year. But it's just hard to gauge until we know what's going to happen week to week as far as the allocations of vaccine.
Yeah.
And also the statewide numbers, there's about 30% of seniors have gotten at least the first dose of the vaccine so far in Florida. Governor DeSantis says that's the highest percentage of any state in the country. So Florida is moving forward pretty quickly on at least getting doses out to seniors. So it might be that Florida might be among the first states to be able to expand the criteria as soon as all the seniors are handled with at least the first doses.
Yeah, and I should say too that, based on what Dave's saying too, Florida might lead the nation as well. And in the state of Florida, Brevard County is 10th in the state as far as the number of vaccinations that have been received by seniors. So again, even though that number is just, around 46,000 people, from a county by county standpoint in Florida with 67 counties, we're ranked number 10 as far as the number of vaccines that have been issued to seniors.
And Don, before we went live, you were giving me some interesting figures. You said Brevard is the 10th county with the largest number of people vaccinated, but ahead of us at 55,000 vaccines are people from out of state. And I know that a lot of people from Florida are going to hear that information and are probably going to be upset about this. Can you explain why more people from out of state have gotten the vaccine than people in a county as large as Brevard?
Yeah, so, well, of course, everyone's heard of the snowbird. So we have a lot of out-of-staters that live here, temporarily throughout the year. And we also know from an emergency management standpoint, which is who I represent as far as the COVID vaccine program, is that a lot of people have taken advantage of the fact that Brevard County was getting allocations of the vaccine to make appointments here, whether they were visiting as tourists or here visiting family, or just coming from a neighboring state to get the vaccine because they knew they were available here. So that's why the governor here a couple weeks ago changed the requirements to where you have to be a Florida resident. So that number is high. They're actually ranked 9th for the most vaccines in the state, but it won't last because now that you've got to be a county not a county resident, but a Florida resident. If you live in Florida, it doesn't matter what county you live in. If you try to get an appointment in Brevard County, you could possibly get one. But if you're out of state, you will now no longer be eligible, which is why we require people when they come to get their shot to bring proof of residency and an ID.
Yes, but some of those people might be legitimate, right? Because they're snowbirds, which, at least by my understanding, the governor's order still allows people who are part-time residents to get the vaccine, right?
Right, and unfortunately, I cannot define how they're defining out-of-state residents. I just know that that's the number that leads Brevard. So I don't know if they're including snowbirds as Florida residents or as out-of-staters, but I do know that tourism was one of the areas cited when they were talking about changing it over to Florida residency. So, for all I know, those are 55,000 tourists, but they are classified as out-of-staters on the list that I'm looking at that ranks the 67 counties, Broward County being number 1 with 144,000 vaccinations. So as large as Broward County is, they've given out just over twice as many vaccines as we have.
Great. And we are getting a few questions here, Don, and we'll try to answer them to the best of our abilities. But Jane is saying that she's saying that people who are homebound and do not have access to a computer, it's good to remind people that they now can register via telephone. So dial 866-201-5420. That's 866-201-5520. The number is here at the bottom of the screen. You do not need a computer now to register. That changed last week thanks to this new state system. So good time to remember that for those seniors. And
we're also asking people, if you have neighbors that are elderly and probably don't have access to a computer, if there's anything you can do, be a good Samaritan, be a good neighbor, do what you can to help them get registered, or get an appointment at Publix. Churches, we're asking them to help reach out to their parishioners. you just have to, it's one of those times where if you can help somebody, this would be a great deed that you could do for them. I've even read in Florida today where, Britt Kennerly did that for folks. I mean, that was, I'm sure a huge saving grace for the person that was able to get the appointment. So just, be a hero today and help somebody register.
Absolutely. And Alina has a question which gives us the opportunity again to clarify things. She says the new website does not ask if you're part of the priority group that is considered high risk. How will they know? Alina, right now only people ages 65 and up are eligible. So right now we're not actually dealing with that issue, right? Dawn, correct me if I'm wrong.
Right.
You have to be at least 65 years of age or a healthcare worker to get the vaccine. So even if you're younger than that and you're not in a hospital, as we talked about Health First getting a batch of vaccines, right now you're going to have to wait a little longer. So
John Scott, who is our emergency management director, he constantly talks about the supply issue. Supply solves a lot of problems. So if it gets to a point where the state can start really ramping up the amount of supplies of the vaccines they're allocating to the counties, that's going to help us get to these types of folks who unfortunately don't meet the criteria, but yet are desperately in need of getting the vaccine. We're aware that those folks are out there. It's just a matter of having the supplies to do what we would need to do to reach those people. Again, as they trickle in, like they've been doing the last few weeks, where we're getting, 1,500 doses on a Monday, and we've got, 10,000 or more people wanting vaccines. I mean, you can see it goes in a matter of, a day or two. So we're hoping, we've got plans in place. We've got expansion plans in place. Again, we're counting on the fact that at some point these doses are going to ramp up, and then we will be ready to get out in the community and do what we have to do to get more shots in arms.
And I believe you have the capacity, even just at the health department, to do about 10,000 vaccines in 1 week, and counting the public sites as well. So the county does have a pretty high capacity to do more shots as long as you have the supply available.
Yeah, at the Department of Health right now, they're averaging 800 to 1,000 vaccinations a day. Last week we got an allotment of 1,500 vaccines, and we were out of vaccines at the end of the day on Wednesday. So, for the most part, operations shut down on Thursday and Friday. But, we are prepared. The commission, the Brevard County Board of County Commissioners, a couple weeks ago approved partnering with hospitals to get vaccines out into the community in North, Central, and South Brevard County. We also have a contractor on board that can help us ramp up the amount of shots we're providing from 1,000 a day to 20,000 vaccinations in a week, utilizing the hospitals and the private contractor and the DOH. So, we have those mechanisms in place. We just need, again, the supplies to do it.
Okay, and actually, Alina, she asked the question about registering on the state website. She said on the state website, high risk are not allowed to register, but you don't have an option to identify yourself as in that category.
Yeah. So all I can say about that is that it's a state registry. So as a county representative or a spokesman, I don't know, why they've configured their registry the way they've done it. What the reasoning is behind it. That may not be a tool that's available now because of whatever reasons the state has not to, activate it or whatever. So yeah, I cannot speak on that.
And I might have actually one of our reporters, Britt Kennerly, just texted me because she's watching this, and she said you can go ahead and pre-register younger than 65 to get email updates when you are eligible. She said that's advisable for those under the age of 65. So just because you're registering doesn't mean you're yet eligible to get the vaccine. But I assume it doesn't hurt. I haven't tried it myself because I know it might take me a few months to become eligible. But for those who are closer to 65, I would at least encourage you to go on the and explore it a little bit and become more familiar with it. Dave, any more questions before we move on? I have a couple more reader questions.
Yeah, I wanted to mention too that anytime the state makes an announcement on, changing the eligibility requirements or makes changes to its registry about who would be eligible or who can register, we will be certain to get those words out there. Right now, just based on what they provided us last Friday when they put that registry in place, is again, it's the 65 and older healthcare worker with direct patient contact, not affiliated with the hospital system, and Florida resident. And I do know there's an icon there for people that are at higher risk, but I don't know. I mean, those people are not currently through the Florida Department of Health. They are not eligible to get the vaccine. They would have to do it at a private hospital, Health First or Palm Bay, and that's if they're a patient at that hospital. But again, you cannot just walk in and get the vaccine. We know that those folks are out there that are at higher risk and are vulnerable. And as the supplies again increase, we will be doing what we can to get to those folks.
And you're also planning, I think, at some point to have more events in communities. There was one at a local church in Palm Bay a few weeks ago, and I think that was pretty successful in getting a lot of vaccines out to the members of that neighborhood. So I think there are plans in the works or proposals to do that in future at other locations.
Yeah, we know that in the underserved communities that there's a need out there as well, and we did do that. We had an event at the Mount Moriah Church in Palm Bay, and we do have one in the works in another area of the county, in the northern part of the county, here within the next 2 weeks. So you will be hearing about that in the days ahead, but we are prepared to do that again, and we will continue trying to organize those.
And Kathy has an interesting question. Are there shots being wasted? I hear of vaccines being thrown away, not necessarily Brevard, because they have to get used within a certain period of time. And is there a list for people to be put on where a person could come in at a last minute?
So none of the vaccines are being wasted. I have heard in other states, even stories where they've thrown away vaccine, which is outrageous, in my opinion. They're very good at gauging how many vaccines that they can get out of the vial and how many they're going to need based on the appointments that are made. That's one of the reasons we have an appointment system and not a first come, first serve system. So, but I can assure you the doses that we receive are being put in the arms of the people that have made appointments, and there are no doses being wasted, nothing left in the vial at the end of the day. And, we're making sure, we do have first responders, and we've done, school system employees that are 65 and older. So, we're getting the doses in arms if there's any additional doses out there, but nothing is being wasted. And you can't show up at the end of the day in hopes that there might be one. You'd probably be wasting your time.
And what happens to that dose? Say I schedule a vaccine and I don't show up. What happens to that dose?
That's a good question. You have to ask FDOH. All I know is this: once they've taken it out of the freezer and put the needle in the vial, they can't put it back in the freezer. So I think they've just done a very good organizational job and system. It's the FDOH nurses that are doing the vaccines. It's FDOH staff and some fire rescue paramedics that are doing the vaccination program. So, whatever coordination and communication they're doing, they're getting the job done, and they're not throwing anything away when it should be in somebody's arm.
Yeah. So don't show up at a vaccination site hoping
I would not recommend it.
any leftover doses. You're wasting your time. And Janie is asking, when do you expect vaccines to be given at Walgreens, Walmart, and Winn-Dix? I know we talked about this, but.
The governor dictates who's getting vaccines. He's, and you never quite know. I mean, he's picked a couple of hospitals with the help of Representative Randy Fine. He gave, when the state got additional doses this week that Dave was talking about, It went to a lot of the hospitals throughout the state, including Holmes Regional Hospital, Medical Center, and also Palm Bay Hospital here in Brevard County. That's all a plus for Brevard County residents. But as Dave mentioned that they may start using Walmart at some point. I mentioned that the Biden administration is doing it to retail, handing vaccines out starting next week to retail pharmacies. The more, the merrier. So hopefully all these other places that are being mentioned will, sooner than later be part of the system that's helping get those doses out in Brevard County. But we don't have a schedule. It's all based on supply and demand. And right now, demand is a lot higher than the supply.
Okay, Dave, any more questions for Don before we wrap up?
I think I got all my questions answered.
All right, Don, anything else you want to say? Any last thoughts?
No, I just want to repeat again, if you'd like to get on the registry and hopefully sooner than later get contacted for an appointment, it's myvaccine.fl.gov or call, if you don't have a computer, 866-201-5420. We want people on the registry. We want to be able to get people appointments. And as those supplies come in, the state will be reaching out to those folks to schedule those appointments. We've got a very smooth system going at the FDOH office here in Viera. We have cars lined up, but they're not stacking up. We're getting people in and out of there. They're getting their vaccine. We are doing second doses. So if you've got an appointment for a second dose, make sure you're there for that appointment because we have the doses available. Basically, it's got your name on it because you got it when you had your first vaccine. So we love the fact that Publix is involved. I would love if Walgreens and CVS start getting vaccination doses, and the more the merrier, like I said. So let's hope the vaccines supply start, really ramping up here in the weeks ahead, and we can start really getting all of our expansion plans in place and getting out to everybody throughout the county.
And don't forget to bring the proper documentation with you when you have an appointment. So the consent form,
bring an ID, bring proof of residency, and bring your appointment card if you're there for your second dose. Bring your appointment card for that. And if you made an appointment for your first dose, make sure you have something that shows that you've got an appointment.
Yes. And again, all that information, the number to call, the website, they're all at the bottom of the screen. Right here, there's a crawler. So write that down. Also, that information is very easy to find online. But Don, thank you so much for doing this with us again. I'm sure we will be hearing from you again.
Sure. Thanks for having me.
I appreciate you taking the time. And thank you, Dave, for your reporting and for helping me out here.
Thank you.